Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi dan salam sejahtera. Bapak Ibu yang kami hormati, marilah kita untuk memulai kegiatan kita pada hari ini kita berdoa. Mudah-mudahan kegiatan kita ini diberikan kemudahan, kelancaran dan diridhoi Allah Subhanahu wa taala. Izinkan saya memimpin doa dengan cara agama Islam. Bagi Bapak Ibu yang beragama selain Islam, kami mohon bisa menyesuaikan. A'udzu billahi minasyaitonir rajim. Bismillahirrahmanirrahim. Hamdan syakirin, hamdan na'imin, hamdan yu'afi ni'amahu wa yukafi majidah. Ya Rabbana lakal hamdu kama yang bagi jalali wajhika karim sultanik. Ya Allah, puji syukur kami panjatkan kehadirat-Mu, karena kasih sayang-Mu kami dapat mengikuti kegiatan internasional webinar PYSYCHOSOCIAL REHABILITATION. Ya Allah, dengan rahmat-Mu kami bersyukur dan mohon ridho-Mu atas terlaksananya webinar ini. Jadikanlah pertemuan ini dipenuhi dengan rahmat, berkah dan karunia-Mu. Ya Allah, Tuhan yang Maha Bijaksana, jadikanlah waktu yang kami lalui menjadi amal soleh dan penuh rahmat-Mu, serta momen yang bermanfaat di dalam tugas-tugas kami berikutnya yang lebih besar dan bermakna. Anugerahkanlah cahaya kebenaran di dalam kalbu kami, agar kami mampu membedakan jalan yang benar dan yang salah. Ya Allah, Ya Rabbi, tingkatkanlah ilmu pengetahuan dan tinggikanlah derajat kami untuk meningkatkan pelaksanaan tugas-tugas kami. Ya Allah, Tuhan yang Maha Pengampun, ampunilah dosa-dosa kami, dosa kedua orang tua kami, dan para pemimpin kami. Rabbana la tu'akhidna in nasina aw akhtana. Rabbana wa la tahmil 'alaina isran kama hamaltahu 'alal ladzina min qablina. Rabbana wa la tuhammilna ma la taqata lana bihi wa'fu 'anna waghfir lana warhamna anta maulana fansurna 'alal qaumil kafirin. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Wassallallahu ala sayyidina Muhammad walhamdulillahi rabbil alamin. Assalamualaikum warahmatullahi wabarakatuh.
Of,
Okay.
okay, your remarks,
Okay.
please.
Thank you very much. I am indeed delighted to be participating in this very important meeting on psychosocial rehabilitation. I understand that this is being organized in connection with the Indonesia's National Health Day. Now, what a great thing it is to celebrate psychosocial rehabilitation and have a webinar on the National Health Day. That means psychiatric problems, emotional problems, which are often neglected in the field of health, in the field of medicine. And when you consider mental disorders, of course, diagnosis, treatment, inpatient management, etc., take the priority. For a small percentage of people who tend to have chronic and severe long-standing mental disorders, rehabilitation is very important. And even in the field of psychiatry, in the field of mental health, rehabilitation is the most neglected area. So I'm so happy that your hospital has chosen to focus on psychosocial rehabilitation on this day. I would like to say a few things about this. Although your deinstitutionalization and rehabilitation of people with chronic mental disorders started in the Western world quite some years ago. In Asia, in most of our countries, rehabilitation has been gone to Yuli, has seen various things there, have had a personal experience and learned lots of things. And then you have come to your hospital and you want to implement all that. And you already have a kind of a program, for taking mentally ill people into the community. It's a kind of a smooth transition that you have planned. It's all very good. I must tell you that I first went to Yuli in 2007, and I have been there on many occasions. And most recently, I met with their superintendent, Dr. Steve, just less than a month ago, and in Kaixing, where some of you also had attended. He told me that it's a process which is going on very smoothly, and it has always been a kind of a miracle that in such a large hospital with thousands of people, they have been able to reintegrate a lot of long stay inpatients into the community with very creative and meaningful rehabilitation programs. In fact, that Yuli Hospital experiment, which has been written about and published also, is an example of how in old archaic mental hospitals with limited resources, if people have the will and the motivation to do rehabilitation, how easily it can be done, and how the lives of many severe and chronic mentally ill people who are locked up in a hospital or an institution asylum setting can be improved, and how their quality of life can be improved. I am very happy to note that Dr. Steve will be speaking later on. I am happy to note that many of the staff of this hospital have gone to Uli and got trained, and they are continuing to support you. I have no doubt that this will be a grand success. You will go on. I have told Dr. Uniar that on a future occasion, I would like to come and visit because I live in Perth. It is not very far away. In fact, the nearest country The nearest country from Australia is Indonesia. And in my department and the place where I work, the Australians, most of them have gone to one place. Not most of them, almost all of them have gone to one place in Indonesia, and that is Bali. And my secretary, Christine, in fact, goes 3 or 4 times a year. So it is a short. In fact, from Perth, the shortest air travel where you can reach another place is Indonesia, and that is Bali. So I hope to visit your center sometime at a later date. I will, of course, discuss with the superintendent and Dr. Uniar, and hope to come and see you. So it's my great pleasure to wish you all the best when you are starting this National Day celebration on community-based rehabilitation, psychosocial rehabilitation. I would like to quote again what Dr. Unia said. The psychosocial rehabilitation journey is a journey with ups and downs. You have to be an optimist. You have to be, hopeful of success. It is not always very easy. As Dr. Steve will tell you later on, there are ups and downs, but if you're optimist and you continue, you will always succeed. So, with all these brief words, I would like all the participants. I notice that a lot of people have joined. I would like to wish all the participants very good luck, particularly all the staff of the hospital, starting from the director. I know that, later on in this talk, there will be the Social Work Association head, the Occupational Therapist Association head. Many of you would be giving introductory remarks. I will not be able to attend the meetings because I've just come back from an overseas travel, and today I have several appointments. So after this, my good wishes and remarks, I will quietly move out of the meeting. Thank you very much. I want to also end by paying my sincere gratitude to your director, Dr. Unia, for inviting me to participate, and wish you all the best. Thank you very much.
Thank you very much, Professor.
Thank you very much, Professor Mohan Isaacs, for sharing your optimistic insight with us. And it's truly an honor, and because psychosocial rehabilitation is travelers and ups and downs journey, we will catch up with that. Thank you very much, Prof. And the next agenda, we have a special message from Professor Dr. Ajalangkara Tanra, PhD, a psychiatrist consultant. He is a chief of Indonesian Psychiatrists Association. Although he couldn't join us in person, we have a recorded video message from him. And let's watch and appreciate the thoughtful words from Professor Tanra.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Dear distinguished guests, speaker, all colleagues, friends, ladies and gentlemen, very good morning. My name is Tanra. On behalf of Indonesian Psychiatric Association, I would like to say sincerely thanks and congratulations of Dr. Rajiman Widyodiningrat Mental Hospital, which is a host and organize the wonderful international webinar on topic of psychosocial and rehabilitation. Rehabilitation has been mainstream in curing mental disorder, and current situation mental health service are dramatically changed from hospital-based to community-based. Schizophrenia is a chronic condition with early onset, higher relapse rate, and functional impairment that often persists despite optimum of pharmacotherapy. So they need adjunctive psychosocial and rehabilitation intervention. Rehabilitation has been shown effectiveness in symptom reduction, relapse prevention, reduce hospitalization, increase social functioning, and satisfactory quality of life. By the attend the webinar, we can explore and share, discuss more deeply quality psychosocial rehabilitation intervention, which the schizophrenia patient could manage them own illness to be able to lead an independent and satisfactory quality of life. Thank you for your attention and wassalamualaikum.
Waalaikumsalam. Our gratitude to Professor Dr. Ajayankala Ratandra for insightful video message. Moving on, we have Mr. Mahrus Asari STRKes, a Chief of Indonesian Occupational Therapists Association, who will deliver his opening remarks. So, Mr. Mahrus Sanusi Asari, are you join with us?
Yes.
Okay, okay, Mr. Mahrus Asari, the screen is yours, please.
Okay, thank you. My voice clearly, Mr. Randy?
Yes, we can hear you clearly.
Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. Thank you so much to all of you for being here today in this seminar. It is an honor for me to speak here on behalf of IOTA, Indonesian Occupational Therapists Association. Let me start by warmly welcoming to the event International Webinar Indonesian National Health Day 2023 in psychosocial rehabilitation, seamless transition from hospital-based to community-based setting. Before we start, I would like to express my appreciation to allow me to address our distinguished guests on this special occasion. First, Dr. Junior SPKC MMRS as a Director of RSC Dr. Rajiman Yudhoyiningrat Awang. Professor Mohan Isak as a consultant psychiatrist in Mental Hospital Australia. Professor Dr. Jayalangkara Tandra, PhD, SPKC Konsulen, from Indonesian Psychiatric Association. Dr. Pujiono, MSW, as Indonesian Professional Social Worker Association, and honorable are all speaker and participants this seminar. Mental health is a universal human right from the statement from WHO. Mental health is a fundamental human right that every human being has. A person must be free from mental problems so that he can attain prosperity in life. People who have good mental health will be able to study, overcome any pressure, work well, study, and contribute to the good of their community. Mental health is defined as the state of a person who can achieve mental well-being. Mental health is part of general health and can be separated from physical health. Mental health that is not well maintained can also affect physical health. Forms of mental disorder include anxiety disorder, mood disorder, psychotic disorder, and eating disorder. In more severe circumstances, a person can suffer from schizophrenia, which makes it difficult to differentiate between real life and fantasy. According from risk stats in 2018, there are more than 19 Indonesian aged over 15 years who have mental health and emotional disorders. In addition, more than 12 million people in the same age range are known to experience depression. Mental disorders like this can cause sufferers to take reckless action such as committing suicide. Based on data from 2016 Research and Development Agency, it was found that approximately 1,800 people commit suicide every year. This figure means that on average 5 people commit suicide every year. Sadly, it's known that around for 7.7% of the suicide perpetrators were aged 10 until 39 years. This group includes the teenage and productive age categories. This is a very serious condition. Indonesian Community Health Index data for 2023 data on depression level between countries in 2023 published on the World Population Review in Indonesia found prevalence of 3.7% from total population. On the other hand, Indonesian population can increase every year to more than 3 million people. From UGM website, there are a number of risk factors related to emergence of mental disorder in adolescents. Risk factors including bullying, school and education, peer and family relationships, sexual behavior, and childhood trauma experiences. Teenagers who experience mental disorder experience problems or difficulty carrying out their daily activities. The research also found that 1 in 3 Indonesian teenagers have health problem in the age range of 10 until 17 years. This figure is equivalent to 15.5 million teenagers. So this is a very big problem for us. Population of occupational therapists in Indonesia until now, we have only 2,300 OTs, more and less. So it's very imbalanced with a population of Indonesian people with a mental health problem risk. So the community base is very important to cover and give proper treatment for mental health sufferers. Talk about psychosocial rehabilitation can be separated from the role of occupational therapy. Occupational therapists provide service to patients with mental disorder ranging from schizophrenia, depression, bipolar, anxiety, and others. To support their occupational independence by identifying and overcoming barriers that prevent them from participating in meaningful activities and using evidence-based intervention, helping individuals develop or retain the skills necessary to perform daily activities. Intervention through various activities including social interaction, handicraft, cognitive, recreational therapy, physical activity, and vocational activities. As part of a professional multidisciplinary team that handles psychosocial rehabilitation in a holistic manner, of course, we strive to provide complete services to reach the highest level. Namely, the patient are able to function according to their work, including being able to support themselves. However, currently, OT services are still limited to hospital-based intervention and not yet included in community-based intervention. Population of occupational therapists, I say at the first, maybe only 2,300 OTs until now in Indonesia. Therefore, in this occasion, We will learn together and provide new perspective for all of us about how to bring psychosocial rehabilitation to the community base, not only in hospital base. So, well, I do not want to take too much of your time. Once again, I say welcome and glad to see you here. Assalamualaikum warahmatullahi wabarakatuh. Thank you.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Mr. Mahrus Asari, for your remarkable remarks. And moving on, let's hear from Dr. Puji Pujiono, MSW, representing the Indonesian Professional Social Worker Association. Dr. Pujiono, your expertise in disaster management and humanitarian response adds a unique perspective to today's discussion. I would like to invite Dr. Puji Pujiono. Have you joined with us?
Sure. Can you hear me?
Yes, clearly, crystal clear. Okay, Dr. Puji Pujiono, the time is yours, please.
Thank you very much. Colleagues, distinguished guests, speakers, as well as leadership at the Rajivan Hospital. Good morning and Assalamualaikum warahmatullahi wabarakatuh. As it was introduced, I am Puji Pujiono. I'm the president of the Indonesian Association of Social Workers. And I'm privileged to join you, the distinguished speakers, in this opening segment of the prestigious event. I will not start by citing numbers and statistics. I think it's sufficient to say, as it was mentioned by previous speakers, that mental health has become, I would not say pandemic, but close to a great concern to all of us. I would speculate, based on educated guests and readings, that the life conditions, the circumstances where we are living in today, constitute a tremendous transformation from conventional living into digital living. From what used to be the disparity of urban and rural has become urbane lifestyle that is more cosmopolitan and borderless. Even the definition of the generation has shifted tremendously. I think the digital living has created a lot of alienations in every one of us in our society. So that's in one hand. On the other hand, we also noted that the coping capacity of individuals, families, society, and public services, including mental hospitals, have been overwhelmed. And this created a situation where there is an asymmetrical between supply and demand for mental health services and care. Now, the second part that I would like to share with you, distinguished speakers, colleagues, and participants, the term psychosocial rehabilitation itself, I would like to start with a critique. The term has been used, misused, and abused to a level that I think the word psychosocial has lost its meaning. There were times when I launched a lot of critics that anything that any health discipline and practitioner, social workers, and anybody that do anything about their patient and clients, they call it a psychosocial. I could cite you in time of disasters, for example. Somebody would come to the disaster area, brought 3 pieces of, soccer balls or a bunch of paper and coloring crayon, and they call it psychosocial. When somebody is talking to somebody, so in sort of speak counseling, they call it psychosocial. Even bringing rice and water, they call it psychosocial. So you see, everything under the sun being done by anyone about anything could be attributed as psychosocial. That's my critique. I myself and our association have been doing tremendous effort to reconstruct the framework of psychosocial, to help the government develop a national guidelines on psychosocial and developing practices so that we would distinguish the psychosocial rehabilitation with, say, other approaches, community-based rehabilitation, community approach rehabilitation, family-oriented rehabilitation. Those are not necessarily psychosocial. I think it's incumbent upon all of us to make ourselves clear of what we are referring to. That's being said, though, I would not instill a devastation